It is Tuesday, right?
It is Tuesday.
All right, making sure.
We are excited to talk about total knee replacements because we get a lot of questions about this. So we're hoping that all the things that we cover will be very helpful for you all. If you joined us on any of our previous webinars, use the chat section to send any questions that you have or any comments. We'll be tag teaming back and forth. So one of us will be answering any questions that you have while the other one is kind of talking and presenting here. So don't be shy with any questions that you have too. Just another minute here. Okay. Okay. All right, you want to go ahead and get started?
Sure. let's get
Okay.
started. So this is just talking about total knee replacements and kind of the physical therapy aspect of it. How to prepare for it beforehand and kind of what to think about for after the surgery. Oh, wrong button. How do I get it to click? Oh, there we go.
If any of you have joined previous webinars, you know me. My name is Jen. I am physical therapist here at Resolve. I've been here for 2 years now. I've been in the PT profession for 17 years. I have done acute care and outpatient therapy. So I have seen total knee replacements fresh out of surgery. So I have a lot of experience with that. And I have rehabbed countless total knee replacements in my career. So that's a little bit about me.
And then my name is Casey Lohman. I'm a physical therapist here as well, but I'm fairly new to Resolve. I've been here, I think, for about 2 or 3 months at this point. Prior to this, I was working in Madras. Just kind of got tired of commuting from Bend to Madras because I live here in Bend. I've known Jenny for quite a few years though, and she was kind enough to offer me a position, and now we get to work together. So starting into our presentation, things that we're going to cover: osteoarthritis and how to know when it's time for surgery. There's a bit that goes into that we'll discuss. How PT can help before the surgery itself. A lot of people don't realize, but we can do something that some people call prehab. Same idea as just getting ready for the surgery ahead of time. Things to prepare for before the operation. So not just from a rehab aspect or a physical therapy aspect, but how to prepare the home, how to prepare yourself for what to expect, and just kind of all aspects of the surgery as well. Next, we will talk about what to expect after the surgery, your recovery, how things can change from person to person, differences that you can expect for things like pain or exercises, range of motion, all that good stuff. And then we'll cover a few like example exercises that we typically start with, some little details there as well. All right, so moving straight into it, osteoarthritis. What does it mean? I'm sure some of us have probably heard the statement bone on bone. So basically the picture, as you can see, the one on the left with the blue arrows, that's your normal joint space. This is an x-ray. Because the x-rays show bone, it does not show soft tissue. What you're not seeing is things like your meniscus or your ACL or any of that connective tissue. So we should see a nice big gap because there's certain things that should be in the way, taking up space, helping keep things moving, like synovial fluid, which is kind of like the oil for your joints. And then on the right side, you see how that same space is kind of squished, especially on the far right of that one picture. All the red lines where bone is touching, that is what they mean by bone on bone. There's no longer those supportive structures, things that help kind of maintain that normal joint space, which is what can cause some pain. Osteoarthritis, things that can kind of be presented as is like stiffness or achy joints, things like that, especially when you're not active. So if you sit in a car for a long period of time, or if you're on a plane traveling, not that many of us do that anymore with COVID, but you never know. But basically you get that stiff or achy kind of feeling after you haven't used your knees for a while. Can also be kind of a really deep pain because it's not a surface thing. It's not like you scratched yourself or, excuse me, like strained a muscle or anything, is really deep in the joint. So it is described as a deep pain. Might be kind of goofy to think about until you experience a deep pain like that. But if you ever have, you probably understand what that feels like. The next bullet talks about there may be some associated deformity. Sometimes it can present as joints that should be nice and straight up and down. Sometimes there's a little bit of a tilt to it, or maybe a twisting. Basically, it's deformed because there's not as much joint space in between. There's no more supportive structures. And that may or may not be happening. So just because your knee looks fine, it doesn't have any of those deformations, doesn't mean that you don't have arthritis, and vice versa. Another thing is kind of the sounds, or like the feelings you get in the knees. Again, going back to after inactivity. So if you've been sitting for a couple hours watching TV, or wake up in the morning, things like that, that first kind of kicking your leg in and out can cause some cracking or some like really deep crunching. There's a lot of things that can make noise. All sorts of different tissues in the knee. Sometimes it's not a big deal. My kind of rule of thumb is, did it hurt when it made the noise? Well, if it doesn't hurt, it's not always a bad thing. But typically these cracking or the crunchings that you feel, they are painful. And we associate that with, it can be some of those tissues that have kind of worn down. So maybe remnants of a meniscus, or other joints, other tissues like bursas, or even the joint capsule itself, things that are all supposed to kind of pad and like support that joint, are no longer holding up. And so you feel them crunching because they're getting ground in between the two bones when it's bone on bone. Now, the big question, does it mean you have to have surgery? Favorite answer in PT is, it just depends. There's so many aspects that go into it. Biggest one is quality of life. If you, let's say you're an avid tennis player and your knees just no longer can support it, you can't even go out on the courts for 10 minutes because it's just the pain's too much, or you catch yourself, any sort of even somewhat rapid movement is painful. Or if you are a biker, or even just a walker, you like to go on long walks, but your knees can't take it after 5 minutes, your knees are just killing you and you have to sit down. I would say quality of life is the biggest portion. And again, it's a very spectrum-y kind of thing. So just because you have this part of the list doesn't mean you need a replacement. But at the same time, maybe this one piece of the list is big enough and important enough for you that you decide to have it. So these are always good questions to discuss with PCP, primary care physicians, or surgeons, or any sort of doctor, and just kind of play with the idea. What does it mean? There's a recovery process. Obviously, it's not like you just get your new joint and then you walk out the door, good to go. So also things that can be impacted are, what kind of plans do you have? Knee replacement surgery, it takes a little bit of time. It's not a quick two-week thing. So if you have things coming up, there's a wedding or something like that in a couple of weeks, and you want to make sure you can walk for it, maybe don't have the replacement right beforehand. Or vice versa. Let's say you have a family member getting married in 7 to 8 months, and you want to be able to walk. It's a destination wedding, whatever the example is. Basically, if you have plans coming up, just make sure to think about that aspect as well. Is it painful? That's another good example. If it kind of hurts a little bit, there might be things that we can alter or change in your lifestyle, or how you're exercising, anything like that, or your hobbies, that maybe we can avoid the surgery. On the flip side, if there's things that you can't do anymore, no matter what we try, things are not working, maybe it's time to consider it. So again, it kind of just depends on if it's time or not. How do you know when it is time? So this is kind of going backwards, or not backwards, sorry, back to what I was just saying. Functional limitations. Daily activities are the big ones. They're very easy things if you think about it. Like, you need to be able to cook, or you need to be able to drive yourself to the grocery store. Basically anything that you do on a day-to-day basis. If that's being impacted, that's probably a big deal. If you can't perform the simple little things because of the knee pain, maybe we figure out some options to change things. Work. If you're still working and you find yourself, unable to perform certain aspects of your job because of knee pain. And it's tricky because sometimes, we try to find accommodations. If you have a job where you stand a lot, maybe they can offer you a stool. But if you have a job where you're walking a lot, there is no stool. You can't just carry around a stool with you all day. So if you're no longer able to work because of knee pain, or if your work is at least being impacted, maybe it's time to consider it. Recreational activity, we talked about that already with tennis, biking, hiking, any of the great Central Oregon activities that we have around here, things that we can do. If you are no longer able to do those, maybe it's time to consider it. Another big piece is, how are the symptoms? So the pain, the cracking and popping, the stiffness, the things we talked about earlier, are they very stable? They don't really change a whole lot. Um, if they're not getting worse or getting better, those are conversations to have. If they're not getting worse, it's not terrible, but it doesn't mean it's great. If they are getting better, by all means, just follow the path you're on to keep it going better. However, if those symptoms are getting worse, try to get ahead of it. So if you find yourself no longer able to go on runs, you can't jog your 3 miles or so that you'd normally do, maybe consider the options that you have before you get to the point where you can't walk from here to the car. Those are big progressions that obviously we would rather have you beforehand. So that way muscles are strong, activities functional. You can do these things and kind of help along the process. Next, so this is kind of going off of what I said a moment ago, preoperative. So the prehab portion. The biggest thing is we can address your limitations and your pain. And this can be a portion of your conversation about, is it time for the knee replacement itself? We can talk about your goals for whatever it is you're trying to do. If you want to be able to kneel down and pick up a grandchild, or if you want to be able to ride your bike and have that constant motion and you're not able to, or if it hurts. Other things, we can prehab you in a sense that we want to get as far ahead of post-surgical outcome when you're going to be really limited in your motion as we can. So we'll minimize sedentary lifestyle. That's a big one. If you spend a lot of time sitting down, muscles are deconditioned, bone density is not very brittle, but can be brittle at that time. It's impacted because there's no demand on the bone. So why do we need to keep the density for it? Whereas maybe after the surgery, you want to get back to tennis. I'm going to use that example again. If you go from a sedentary lifestyle because you don't have the ability to play those games or do those things that you want, we need to do some sort of activity. So that way, when you're done with your surgery, you're not already starting from scratch because you haven't done it in years in the first place. It may not be completely related to the goal, but we can at least put you on that path. Things that involve with that are range of motion, strength, flexibility, cardiovascular endurance, balance, all of which are pretty much included with most activities that we do, even some of our daily activities. Carrying groceries in from the car can be pretty tricky if you don't have the strength, or if you don't have the range of motion to lift those bags up onto the counter, things like that. If you live in a house that has 1 or 2 stories on it and you have a bunch of stairs, or if you have issues with balance, but you love to cook and you're constantly pivoting back and forth and you're worried that your knee pain might cause you to lose your balance one day. So we want to improve all those things before we even have the surgery to make sure we have a great foundation to start from once surgery is done. Other things are, it prepares you for better outcomes just because you have that foundation like we talked about. Other pieces is that we can educate you. 1, what to expect. 2, we can teach you things while your knee, it still hurts, but it's not because it's post-surgical. So you already know how you typically walk. You know how your house is laid out, things like that. So we can teach you how to use a walker beforehand, before you have to rely on standing on one leg or the scooters and things like that. Next, we can teach you about how to navigate steps. It's a lot harder to use a walker going up and down stairs when you have one knee that's post-surgical, as opposed to before the surgery. We can teach you because you can at least put some pressure on that foot right away. That's one thing we don't want to wait until the last minute, because it's do or don't. Either you figure out how to go up and down the stairs, or you just avoid the stairs. Other things we talk about are how to prepare your home. Things like making sure tripping hazards are out of the way. Little details like, make sure you have a straight shot from your bedroom to the bathroom. So that way, if you get up in the middle of the night, you're not trying to navigate around, dressers or rugs or carpets, power cords, anything like that might be a tripping hazard, because the last thing you want to do after a surgery is trip and fall and land on that post-surgical leg. Probably won't feel very good. Equipment recommendations, depending on the layout of the house, we can have discussions. You might need something like a bedside commode if the bathroom is clear down the hallway, or heaven forbid you live by yourself and there's no one to help you. It might be easier to just make sure you don't have to travel that far. Just get up next to the bed. Other things are making sure that if you do have stairs, is there a handrail present? So that way you have some sort of sturdy grip on something that's not going to aid in you falling down. We want to make sure that we have maybe handles around the toilet if you are using the bathroom. Basically, just the little things no one thinks about until it's time to have the surgery, and now it's too late to prepare for it. Lastly, make sure that your care team is prepared. So that's, not just physicians and nurses and doctors, but that's also family. It's making sure that if you're not going to drive for the first couple of weeks, you want to make sure you have a line for groceries. Make sure somebody's talking to you about if you need help preparing your meals because you can't stand on your knee for the first few days, or whatever precautions you have, things like that. Just make sure people are aware of your situation. If you live with a family or significant other, how can they be prepared? Mention things like, oh, I'm going to need your help with this. Or in the past, we've had patients talk about how they actually practiced sleeping on the opposite side of the bed. So that way their operative knee was a little bit easier to get in and out of the bed. So just little things to think about before you come to that situation. Preparing the home. This is the big one a lot of people don't think about. The trip hazards and slip hazards, power cords or extension cords, and rugs. They are very big pieces that incorporate a lot of people falling after either surgery or even without surgery. Rugs, they look great, especially if you have a hardwood floor, kind of has a little bit of padding and cushion and keeps some, temperature control, but that's the quickest way to catch a toe as you're walking, or the corner of your walker, or even a piece of your cane, things like that. So trying to avoid those, or at least get them out of the way temporarily. Pets are another big one. Everyone has that cat or dog or some sort of pet that I don't think I've ever met someone that said they don't get under their feet all the time. Accidentally kick your cat or step on your dog's tail or things like that. And the last thing you want to do is hurt them. So your reaction is to jump up on one leg. Well, heaven forbid that leg you decide to stand on is the post-surgical leg. Probably means you're going to go down, or heaven forbid trip on them too. Steps are a big one. They're part of most houses. And so making sure you have a handrail or something to use your hand with, because even one stair, one step into a threshold, things like that can present a pretty big problem. Especially if you're not used to navigating with a walker or a cane or any sort of assisted device. You want to make sure that you have that practice. And so that way you're prepared for it, and heaven forbid things go weird, you want that nice sturdy handrail or at least something to grab onto that will help keep your balance. Minimize clutter. My house is notorious for clutter. There's always just little things that you just either you put aside, or it has its own spot that you want to put it in, but for now you're just going to set it there because it's out of the way for the moment. So before surgery, making sure all that little clutter is out of the way. One, if you're the cleaner type, you don't want to get a sudden urge to clean the whole house after your knee surgery. And two, it's not something you're going to trip on or get in the way. Or if it's, some of the mail from the other day, you're not going to try to put your hand down on the counter and then put it on some mail and slide your hand around. Lastly, another piece is chairs with armrests. If you have knee pain before the surgery, chances are you try to use your arms when you're standing up out of a chair, but you don't realize how much that really comes into play after your surgery and you can't stand on that one leg. It's really important to make sure every chair you sit in, whether it's the kitchen chairs or the dining room, even your bedroom, things like that, if it has a chair, making sure it has armrests so that way you can have that extra assistance on standing up, because you may not always have someone right next to you to help you stand up, especially if you have to run to the bathroom really fast. Equipment recommendations, we kind of talked a little bit about some of these. Walker and cane are the first ones. Biggest thing is making sure you're mobile. We want to make sure you're not stuck in bed 24/7, because typically post-surgery, we want you walking very quickly. Movement in the knee is very important. So making sure you're able to do so safely with the walker first and graduate you to the cane, if that's something we determine is important, or if you were walking before with a walker, just making sure everything's safe and you know how to use them appropriately. Next is a raised toilet seat or a bedside commode. Again, the bedside commode comes in real handy if your closest bathroom is clear down the hallway around a couple turns, things like that. So sometimes if that knee's hurting, you're in the middle of the night, you wake up for whatever reason, you got to use the bathroom. Instead of trying to navigate dark hallways, go through the bedroom, making twists and turns, it might be easier just to have the bathroom right next to you. The raised toilet is really nice because coming up from out of a chair, especially if your knee hurts, the deeper the chair, the harder it is to stand up. And so after using the restroom, sometimes having that extra couple inches of seat height really makes a difference on how safe it is for you to stand up, as well as when you're sitting down. If you have a really low toilet seat, I know no one wants to admit it, but some of us plop down really quick. You know where the toilet's at, so you just sit down. That raised elevation just makes it that much safer. Shower chair is a good idea because if you're standing in the shower, it's really hard. Walkers, typically you're safe to put in the shower as well. You can hold them, but then you're holding onto a walker with one hand while you're trying to wash your hair, clean your body, run the hair or the water spigot thing itself. Sometimes you just need a chair. Just sit down, take that out of the equation. You can wash yourself, clean yourself up, and it's just makes life that much easier. Grab bars. So similar to handrails and you're like going up and down stairs, but grab bars where you don't typically think about it. So if you don't have the raised toilet seat like in the picture that has handles, is there something you can use to help use your arms to pull you up out of a chair? Shower, bathroom, things like that are where people typically think about it. Lastly, the grabber, the reacher, the little trigger on hands kind of thing. Heaven forbid you drop something. Last thing you want to do is bend too far forward to try to pick it up, because it's second nature for us. We've done it our whole lives. So why not? Oh, drop your pen, just reach down and grab it. But now you can't put the weight in your knee because you haven't been able to because of the surgery, or you just haven't done it recently. And so now all that pressure you put in your leg, it collapses, and heaven forbid you go down. Easier to just get one of those big long grabbers, reach down and pick it up that way. Or heaven forbid you're trying to get into an overhead counter. Let's say you ran out of paper towels and you keep them on the top shelf. And instead of trying to stand up and reach for it on your tiptoes, because maybe you're not all that height like me, I don't have a whole ton of height, so I got to reach on my toes. That little grabber can just add that extra little bit of reach and just take any issues out of the equation. Lastly, we got some care team stuff. So again, these are not necessarily always just your nurses and your doctors and your physical therapists. It's people that help you at home. Personal care, things like how are you going to be able to get in and out of the shower? Washing laundry. I'm sure the last thing you want to be doing a couple days post-surgery is swapping laundry from the washer to the dryer. So seeing if you have family or friends that can help you with that. Transportation, you typically don't drive right after a surgery like that. So making sure you can get to your appointments, your follow-up with your doctor, heaven forbid to the grocery store or things like that. You just need to make sure we have transportation available. Cooking, cleaning, household tasks, we talked about that. There are going to be things, you're still a person, you've grown your whole life with picking up after yourself, and I'm just going to grab that dish and wash it real quick, or I'm just going to make myself a sandwich, things like that, that now might be pretty difficult to do on your own. So just making sure you just have help. Running errands, life doesn't stop because you had a surgery. You still got to make it to the post office or drop this thing off with that person, whatever it is, there's still things to do. So just having people help you with being able to do those little things for you. Assist with exercises. A lot of us, some of the exercises we give you are pretty easy to do on your own. Some of us also need that kind of external source of someone telling you, hey, did you do your exercises today? Because there's ones that we give you after your surgery that we want you to do every day or multiple times a day. So someone to either stay on you and make sure you're performing them, or there are some exercises that it's safer to just have somebody close at hand, heaven forbid you do lose your balance or something like that. And then also caring for pets. Cats seem to be pretty easy for the most part, but you might have to have help cleaning a litter box, or if you buy like the Costco size bags of cat food, probably not picking up 40 pounds worth of cat food to feed your cat. Same thing with dogs or other pets. Dogs, you're probably not walking your dogs unless you've got a little tiny thing that you can walk with your walker for the whole, quarter of a block. If you have big dogs, I don't recommend you walk them on your own. Ask people for help, family, friends, things like that, because they still need the same care. Typically, it's about 2 weeks or so post-operative that is the most bothersome. That's when people have the most restriction and they need the most help. Typically, after 2 weeks, things start to improve enough that you can do some of these on your own. Again, the pets are kind of a hard one to anticipate depending on the size, but things like personal care, typically after 2 weeks, you can, brush your teeth, stand at the sink and, do that kind of thing, or little stuff like make yourself a sandwich, heaven forbid, wash a plate. It's normally those first 2 weeks that are the toughest to be able to help yourself. All right, so here we are. I'm going to let Jen take over for this next part.
Okay, little switcheroo here. So far, anybody have questions on the preoperative stuff? I know it's a lot of information to kind of consider, but quite honestly, preoperatively, the more you can be prepared, the smoother the post-op process goes. So that's why we really emphasize doing the prehab things, like really optimizing your function before going into surgery, making sure your home is set up, making sure you have, enough help at home, or you're going to have people to give you rides to places that you need to be, those types of things. So the more you are prepared preoperatively, the smoother the post-op process goes. So if you guys have any questions on that, feel free to shoot those over to Casey in the chat section. So I'm going to talk about the surgery itself. and then kind of what you're going to anticipate from the recovery perspective, and then physical therapy after surgery. So going to keep the surgery part a little vague for the most part. I have been fortunate enough in my career to see numerous total knee replacement surgeries, and it's intense. It is a very intense surgery. I think the biggest thing to keep in mind is that it is a very common surgery. I'm sure anyone can name, at least 5 people they know that have had their knee replaced. So because it is such a common surgery, I think people really forget that it is it's a very tough surgery to go through. One of our nurse practitioner colleagues, she said it best, and she said, surgery is stressful even under the best of circumstances. So even when you are prepared, it's a lot for your body to go through, especially doing a joint replacement surgery, because there is so much rehab post-operatively. So the replacement itself. So keep in mind that every orthopedic surgeon does things a little bit differently. So some surgeons use the Makoplasty, which is very easily stated as the robot. They'll use the robot in surgery, which is a newer technique that's come out. So some surgeons are trained in the Makoplasty. Other surgeons still do the knee replacement very traditionally. So every surgeon has their preference in how they do the surgery. But as a general synopsis, what we're looking for is, if you look at this picture here on the left side of the screen. So this is just kind of a generic picture of, what we would anticipate something, to look like in a very arthritic knee. You can kind of see all these rough edges here. That's typically where that smooth cartilage should be, and that's all worn down. Like Casey was saying earlier, that meniscus you can kind of see through here is a little bit degenerated, those types of things. So essentially what they're going to do, and like I said, I'm going to keep this a little bit vague to not get too graphic with what they actually do, but essentially what's going to happen is the surgeon's going to go in and they're going to basically kind of trim down this arthritic bone, and that essentially is going to make room for this new prosthesis that they're going to put in there. So they're going to trim off some of this bone, kind of smooth off that surface, and then they will use a drill and some cement and those types of things to implant that prosthesis up into your femur bone here on the top part of the knee joint, and then down into your tibia here on the bottom part of the knee joint. So again, when it comes to the actual replacement itself, every surgeon's a little bit different, but they do, if you have had any, bony deformities, like Casey was saying earlier, like if you end up being knock-kneed or bow-legged or those types of things, that will all be corrected in the surgery itself, which sometimes can be, an adjustment afterwards. If you've been knock-kneed for years and years, and now all of a sudden you're going to go in and have the replacement and your knee ends up being straighter, sometimes that's an adjustment in and of itself because your body's not used to that position. But a lot of those deformities do get corrected in the surgery itself too. So this is kind of a good schematic here of kind of what that prosthesis looks like. A lot of times on the end of the femur bone here, and into that tibia, a lot of the prosthetics nowadays are titanium, and then there's like, we just kind of say like a plastic piece in between here, but it's like a very dense type of material that fits in between those two. So that's what ends up reforming your knee joint. And if you ever want to see what a total knee looks like on an x-ray, here's what it is. So you can kind of see that prosthesis implanted down into that tibia, and then also up on the end of that femur as well. So it does look kind of cool. A lot of times too, people always ask this question of, if you're traveling, you're going through the airport, is it going to set off the machine? A lot of times they'll give you a little card that says you've had your knee replaced, and it's not an issue when you're traveling or things like that. But it is kind of interesting to look at this knee replacement on an x-ray if you've ever wanted to see what that looks like. So let's talk about the actual surgery itself and then what you're going to experience immediately post-operatively. So I've been fortunate enough, like I said, to work in acute care for a long period of my career. So I have seen patients, the same day of surgery. I've gotten patients out of bed. And it is very common nowadays that the surgery is considered an outpatient procedure. So it used to be years ago that you would have your knee replaced. You'd stay in the hospital for, 5 to 7 days. With the changes in technology, the changes in surgical techniques and the hardware and things like that, it's basically now an outpatient procedure. Sometimes you will end up staying overnight. It kind of depends on the time of day that your surgery is, but a lot of times you're in and out and home within a day. So turnaround time is pretty quick. Um, One thing that to anticipate is you will have to get out of bed, you'll have to walk, you have to do stairs before you can go home. So you'll typically have a physical therapist that will come in, make sure that you can move around okay, make sure that you're going to be safe, you can use your walker, those types of things, that you can navigate all of those things before going home. The biggest thing that a lot of people are surprised by is the swelling and the bruising post-operatively. So like I said, there's a lot of work that goes into the actual replacement surgery itself. I think the best way to describe it is it's essentially kind of like a construction project that happens in the OR. So we have patients who, do fairly well, and they have, some swelling, no bruising at all. And then we've had patients who are bruised from, hip to toe. Everybody is a little bit different from that aspect as well. So some people end up being far more swollen and far more bruised than others. And oftentimes, when you end up more bruised, it can be a little bit of a shock at kind of looking at your leg for the first time. So keep in mind that the swelling and bruising is very normal. The knee replacement surgery itself is pretty traumatic. I mean, they're going in there and they're doing a lot of work in that joint. So there is a lot of, a trauma associated with that. So that's why you do experience the pain and the swelling and the bruising. One of the bigger things that we really kind of stress on post-operatively is pain control. So this is something that is very, very important because pain control is going to dictate, how smooth essentially the first few days post-operatively are going to progress. Keeping on top of the pain is a big thing that we push for, because you want to make sure your pain is controlled. You want to make sure that you're going to be able to get up and get moving and do your exercises and do all the things that you need to do. I won't dive into, specific pain medications too much. Again, every surgeon kind of has their preference on what they prescribe for medications. But a lot of times it is a narcotic pain medication. Some patients really do not like taking those. So there's any number of different varieties of pain medication that can be prescribed. The one thing I always recommend too is that if you have been prescribed a particular medication and you're taking it, as the doctor recommended, and you're still having a lot of pain, call the doctor. If there's a medication that's just not working for you, I promise you there is something else that they can prescribe for you that might work better. I think that's the biggest thing I see is patients trying to be really diligent about keeping their pain under control and taking the medication, but they're still just not where they want to be with that. And I always recommend call your doctor, let them know, and they can switch up what they're prescribing you as well, because the pain control is going to be kind of a big factor in jumpstarting your rehab process and improving your mobility. So we can't stress that enough. A lot of times you'll go home and you'll have a little bit of an ACE wrap, usually over the knee, but there'll be post-op dressings. If you can see in this picture here, we call this one kind of a Tegaderm, or it's like a waterproof post-op dressing. Some doctors use this one. Again, every post-op dressing is a little bit different. Every surgeon's preference is different too, but this is a pretty typical one that you see. You can, like I said, these are waterproof, so you can shower with these on, and they typically come off after about 7 days or so. But again, everything's a little bit different based on surgeon preference as well. The other thing that's very common is that they'll want you to wear compression stockings, which are those white Ted hose. Those really, I kind of equate them to being like pantyhose. They're just super tight. Those are incredibly important to help manage the swelling in your leg, but also for helping to prevent blood clots too. So oftentimes after surgery, you're not moving around as much. You have a lot of this swelling. Maybe you're more sedentary, you're sitting more, that type of thing. The risk, and after having surgery too, the risk for a blood clot is there. And so using the compression stockings to help kind of manage that and minimize risk is very important. Anywhere from usually 2 to 4 weeks is when they want you to wear this. They'll kind of give you those instructions in your when you're discharged from the hospital too. But on your first visit to outpatient therapy, we assess swelling. We kind of see where things are at, and we can make recommendations too on, hey, you still need to be wearing these, that type of thing too, because they are very helpful for managing swelling and reducing that risk of the blood clot. So after you leave the hospital and you go home, there's typically two options for you. You can have home health therapy or outpatient therapy. So home health therapy typically is for patients who maybe they live alone or they don't have family here or they can't get a ride to and from therapy. Home health is where the therapist actually will come to your home and do therapy with you in your home. So there's a couple stipulations with home health therapy. You have to be considered homebound. So you can't be, gallivanting around town, going to restaurants, things like that. You have to be considered homebound, where basically you're only able to leave your home to go to doctor's appointments, church, and I think to get your hair done is the last one. So you basically really have to be confined to home in order to qualify for home health. In our practice here, we do sometimes see patients for 1, maybe 2 visits right after they get out of the hospital, just if they're not moving around very well. They just need a little bit of help kind of improving their mobility around their home first in order to progress them to coming to outpatient therapy. So obviously outpatient therapy, that's the clinic that we're in here at Resolve. This is when our patients come to our clinic to see us. And again, post-operatively, typically your therapy is 2 to 3 times a week, depending on how you're progressing after surgery. But I can't stress enough that surgery is the starting point to the knee replacement. The physical therapy part, the PT part of it, is where the work really, really comes in. You just have to be diligent about doing those daily home exercises. We can't stress that enough with our patients because that's going to make the biggest difference in your progress too, is doing those daily home exercises. And then this wonderful picture here shows the Polar Care machine, or the ice machine, as a lot of people call it. This machine is wonderful for helping to manage pain and swelling post-operatively. It's just like a giant cooler. And there is a little hose here and this little pad, and the water just kind of recirculates through here instead of messing with, bags of ice and things like that. Just using this Polar Care machine works wonderfully, just plugs into the outlet. We always recommend the secret water bottle trick. Some people already know about this, but they oftentimes are very surprised when we mention this. So instead of constantly filling ice cube trays and dumping this into the Polar Care machine, oftentimes the freezer can't keep up with your demand for the ice. So we usually recommend taking some water bottles, throwing them in the freezer, and then just throwing the water bottles in the Polar Care machine. And then when they thaw out, just swap them out with new water bottles. That way you're not messing with ice. You're not making a mess on the floor. You're not having to dump out water or have someone from your care team haul it to the bathtub and dump it out. Frozen water bottles in the ice machine work wonderfully. So we really recommend using that trick. But Polar Care machine is wonderful for helping to manage pain and swelling. And typically they give you one of these before you leave the hospital too. So in terms of when you start the rehab process, kind of what we're looking for, these are some kind of goals that we sort of shoot for post-operatively. So in the first 1 to 2 weeks, again, what we're trying to control is pain and swelling. That's kind of the biggest thing after surgery, is that trauma to the knee joint, and making sure that we can minimize the pain and swelling, because the more we can reduce the swelling, the more you'll get the range of motion back faster, and typically the less pain that you'll have too. So that's the biggest one. The other thing we look for is improving that range of motion from 0 to 90 degrees. So 0 degrees would be having your knee all the way out straight, which is very important. We want to get that knee all the way straight. That way you're not walking with a limp. And then bending your knee to 90 degrees, or that right angle. So that 90-degree mark is kind of what you need to sit in a chair comfortably, to get in and out of the car and kind of position your leg comfortably. Like Casey said too, sitting down on the toilet, you need to have good range of motion with that. So, and at least in the first 1 to 2 weeks, kind of 0 to 90 is the goal. If you get beyond 90, that's great. But that's kind of the minimum that we look for in that first 1 to 2 weeks. And then again, starting those home exercises, even on the same day of surgery. So doing those ankle pumps, and we'll kind of go over these a little bit more at the end here to wrap up, but doing the ankle pumps to help with swelling and reduce the risk of those blood clots. We do quad sets. We're, doing the stretch to try to get that knee straight, working on bending the knee, those types of things too. So again, home exercises are very, very important to kind of start those right after surgery too. In this picture, you can see, this is a picture of a patient who is about 2 weeks post-op here. This particular patient had staples on his incision. So as you can see, he's pretty swollen through here, but the incision looks really good. It's nice and clean. There's no oozing or drainage and things like that. Those are all things that we look for. And again, whether you're going to have staples or not is a different story per the surgeon. Some surgeons don't do staples anymore either. But if you do have staples, this is kind of what your incision would look like. And then weeks 3 to 4, this is the same patient who had the staples removed. So you can kind of see how that incision will kind of lay down a little bit flatter, and will continue to heal as the weeks go by too. And you can definitely see that the swelling is a little bit better. The bruising is a lot less, those types of things too. So this is kind of typically how the knee will look kind of at that phase of recovery. So again, what we're looking for from a PT perspective is still managing pain, any residual swelling that you have in there. A lot of times, a lot of the bulk of the swelling will go away in the first, usually in the first 3 to 4 weeks. Sometimes you can have some lingering swelling that comes and goes. That's totally normal. But a lot of that immediate post-op swelling, we're looking to have that out of the knee by this point. Your walking will be better. You'll be able to tolerate walking further. And at this point, most people are progressing away from their walker, usually going to a cane as well. But again, this is all dependent on the person. Depends on your balance, those types of things too. So some people do need to end up being on the walker a little bit longer, but typically the 3 to 4 week mark, you are typically progressing away from the cane. And then also you'll be getting a little bit more independent with what we call ADLs, or activities of daily living. So those are, bathing, dressing, standing in the kitchen to cook a meal or do dishes, those types of things. You'll start to feel better in general, which in turn will kind of want you to do a little bit more as well. But getting on and off the toilet, those types of things, all of that will be getting better at this point of the rehab process. The other big thing we hear from patients is sleeping. Everybody seems to struggle with sleeping, which is totally normal. In some patients, it does take a little bit longer for sleep to kind of become a little bit easier, but usually by about a month out, your sleeping should be getting better as well. So we all know that sleep is very important for healing too. So this is kind of a critical piece in that post-op recovery. But by this stage, after a couple weeks, it should be getting a little bit better. And then we're looking for your range of motion again to be at that 0 or that full extension mark. And then obviously progressing. Typical range of motion after a knee replacement, we look kind of 120 degrees is kind of a generic number that we look for. We don't like our patients to get stuck on that number. The most important thing is function. So can you do the things that you need to do? Can you get in and out of the car? Can you go up and down steps? Those types of things. But as kind of a basic benchmark, we're kind of looking for at least to be around the 110 mark at this stage post-operatively. And then week 4 and beyond. Again, the amount of time spent in outpatient therapy post-operatively varies from person to person. And so I think the biggest thing to keep in mind is usually it's 6 to 8 weeks, depending on, what your goals are and how you're progressing along. So kind of beyond that 1 month mark, pain should be pretty minimal at this point. And again, swelling should be pretty minimal as well. You'll kind of notice it'll wax and wane, but for the most part, a lot of that post-op swelling should be gone. You'll be walking without the cane. Your balance will be getting better. You'll kind of just start to feel like you have more energy in general. A lot of times, you'll get back to driving as well. So that's kind of the big thing, especially if your operative side is your right side, operating the gas and the brake. That kind of depends on how quickly, if it's the right leg versus the left leg. But The key component to getting back to driving is you must be off the narcotic pain medication. So you cannot be driving under the influence of pain medication. So that is the big kicker with that one. And then your comfort with driving too. That's another big thing is oftentimes we have patients that are just like, I don't know if I'm ready to drive. If you don't know if you're ready to drive, you're probably not ready to drive. It's something that you really have to be prepared for. Um, and so that's one of the things we often tell people, practice, going up and down your driveway or have somebody take you to an empty parking lot and try practicing driving there to kind of see what your comfort level is too. And then again, just overall mobility function, getting you back to your normal daily activities, going up and down steps normally, kind of getting back into the normal groove of life is pretty much what we do, month one and beyond there. So everybody's goals are different with what they want to do. Some people want to get back to just walking every day. Some people want to return to biking and things like that. So based on your goals that you want to be able to accomplish, that's kind of where we start looking at kind of the 1 month mark and beyond there too. So just to kind of emphasize, the biggest keys to success are doing your exercises. Trust me, as PTs, we know if you're doing them or not. We can tell based on the progress that you have when you come into the clinic on how well you're doing. So, oftentimes you're coming to see us twice, maybe 3 times a week. It's on you those other days of the week to be doing the exercises that we give you. That's how you're going to get the best benefit and make the most progress. The other thing too is restoring that range of motion early on. Like I said, we want to get that knee all the way straight. That way, you can stand up straight. You're not walking with a limp, those types of things. And also getting that flexion or that bending motion back as quickly as we can as well. Pain and swelling. We can't speak enough about that, of getting that under control. Sometimes what happens too is when patients hit like that 3 to 4 week mark and they start feeling good, is they start really wanting to do a lot of activity. And so just kind of cautioning you on avoiding doing the dreaded too much too soon, which is oftentimes a recipe for setting yourself back a little bit. So everything is about slow, steady progress for the most part. So you don't want to jump back into doing, like Casey said, cleaning your entire house and doing things like that. It's all about pacing yourself and kind of seeing how you're going to respond, getting back to activity. Because again, doing too much too soon, you can end up with more swelling and more pain and those types of things. And the other most important thing too is comparing yourself to other people. This happens, I can't even tell you how often, where we have a patient who's like, well, so-and-so was on a cane at 2 weeks, or so-and-so is back to doing this. Or I know a person who, whatever the scenario might be. The biggest thing to keep in mind is that everyone progresses so differently. We're all individuals. We all have different comorbidities in terms of our health and our activity level. And, if you were limited by the knee pain prior to surgery, if you were sedentary because it hurt to do activity, typically that's going to make you progress a little bit more slowly afterwards. And so it's the old phrase, you can't compare apples to oranges. Everybody is an individual. The goals that, I just outlined from week to week are kind of our goals that we look for. Some people progress much more quickly. Some people progress a little bit more slowly. The biggest thing is that we're making progress. And so try not to compare yourself to, any other person that that has had this surgery, because everybody reacts to anesthesia differently. Pain control is different. We all progress at a different rate. So keep that in mind and just know that you're an individual person and you're going to progress at whatever rate your body wants to heal. So that's a big piece of the puzzle for sure. Okay, so we're going to go over, I call these the foundational exercises. So these are the exercises that we typically give patients if we're doing a prehab type process. And then also these are the ones that we typically want patients to start doing right after surgery. So I call these the foundational ones because these are the ones that you really have to start off with in order to get the range of motion, get the strength back, and then we build from these exercises here. The first one, good old ankle pumps. So this is the one where you're just moving your ankle up and down. So I recommend doing this, if you're icing your leg, if you have that Polar Care machine on, you got your leg elevated, doing some of those ankle pumps, just pumping that foot up and down. Again, great for swelling, reducing the risk of blood clots. Even if you find yourself sitting or you're in the car or you're having to be in that position, just kind of moving that foot up and down too, does kind of help with some of that swelling as well. The quad set exercise, we did a video of this one because oftentimes people get a little bit confused on this one where you're actually wanting to push your knee down into the table. Sometimes what will happen is that people will try to push their whole leg, or they'll just kind of squeeze their glute muscles or kind of tighten their butt muscles when they do it. This one, you actually want to be squeezing that thigh and trying to push that knee down. This is going to help build that quad strength. And this is also, as you can see, this is Jenny doing that quad set motion. It's going to help to get that knee straighter as well. So this is basically strengthening 101. This is a very important exercise to do. And again, it's one that you don't need anybody's help to do. You can do this one when you're laying in bed for sure. The next one is the heel slide. So oftentimes this one is people's least favorite because it's pretty stiff and sore and swollen. This is just working on that knee bending motion, that flexion with going straight up and down. You can do this one laying down, depending on how soft your bed is. And I will say, do this on the bed. Please do not get on the floor to do this because you will have a hard time getting up. But you definitely want to lay in bed to do this one. So depending on how soft your bed is, this one can be a little bit tricky where you might need somebody's help to put their hand underneath of your foot to kind of help you bend up and down. A lot of times it's not super comfortable for patients to do. So what we'll recommend is, like this gentleman is in this picture here, is sitting in a chair and then putting a towel under your foot. And if you have like a tile floor or a hardwood floor, things like that, where you just bend that knee back and forth and you slide that foot back and forth while you're sitting in a chair. It's usually a little bit easier. You can do it on your own. And oftentimes, we're going to be sitting up in a chair quite a bit more than we are laying down. So this can be a little bit more convenient to do as well. And sometimes a little bit more comfortable, but either way, the heel slide is important for getting that knee flexion range of motion through there. This is the knee extension stretch. So basically what we have with this one is we just have a yoga block here, but you can prop up, some towels or a pillow, or if you have like a foam roller, anything that you have where you're going to put it right underneath your ankle or your lower leg here. And you're basically just letting that leg kind of stretch out straight. So this is one where you just position or you prop that leg up. You can even use a footstool as well if you're sitting in a chair and you put your heel up on a footstool, but this is going to help to get that knee straight. So this is one where you have to really work into this stretch. Oftentimes it's a little bit uncomfortable. So starting off, even just doing 30 seconds to a minute is usually enough, but then building up to trying to do this for about 3 to 5 minutes total. And again, this is just a nice passive stretch where you take that knee and you prop that knee up, and then gravity is going to kind of help straighten that knee out eventually too. You can always put an ice pack over your knee when you're doing this as well. Kind of kill two birds with one stone there. The biggest thing with this one too is keeping your toes towards the ceiling. So oftentimes what happens is we'll see patients, instead of their toes being straight up, they'll kind of rotate their hip out, sometimes rotate in, but typically it feels better when you rotate your foot outward and kind of roll that hip outward. Then you're not getting a true stretch through that leg. So you want to keep those toes kind of straight up towards the ceiling there just to get that true stretch. This one is called a short arc quad motion. So this is again, working on that quad strength and also to help to get that knee a little bit straighter as well. With this one, we use a foam roller typically, but you can roll up a pillow, you can roll up a blanket, anything that you have that you can kind of prop underneath of your knee. And you're basically just trying to lift that heel up, kind of squeeze that thigh muscle and hold that leg straight, and then lower it back down nice and slowly. And then the last one is the straight leg raise. So this is often the hardest one to be able to do on your own. This one typically you need a little bit of help with. So this is having the leg all the way out straight. and you're going to try to kind of squeeze that thigh muscle, straighten that leg out first, and then just trying to lift that leg up and down. So again, trying to build some of that quad strength through there. And when you lift the leg up, as you can see in me demonstrating in this bottom picture here, you don't have to go very high with the leg. You really kind of want to keep that leg no higher than where the opposite leg is bent. So it doesn't take a lot to lift that leg up there, but you definitely don't have to lift that leg, up as high as you can. It's really just about a foot or so off the bed. But this is one that does take a little bit of time to build up that strength. So that oftentimes this will require a little bit of help with somebody helping you out at home. Okay, so just to kind of wrap things up here. So just some key things to remember. Everyone is going to progress differently based on pain, swelling, those types of things. So just really be diligent and be aware to not be comparing yourself with others, because all of us are going to progress at a different rate. And that's totally fine. Surgery is the beginning of this process. Physical therapy is really, is going to be what gets you to the finish line. So oftentimes I'll tell people, immediately after surgery, you're going to wonder, what the heck were you thinking? I promise you, by the time it's all said and done, you'll be glad that you did it. It does take work, and it does take consistency and effort. But you will get there. You'll get back to doing the things that you want to do, and you'll be able to do it pain-free, and you'll function better, and you'll move better, and you'll be able to spend time with grandkids and do all the things that you want to be able to do. But it does take work, and it does take effort to get there. So being really diligent about doing those exercises, and just really putting in the work and the effort with physical therapy will make the biggest difference for you. And again, it's a common surgery, but it's definitely not an easy one. I can tell you, ask any person who has had their knee replaced, they will tell you it is hard work, but it is worth it in the end. Just keep in mind, it does take time for you to kind of feel like you kind of get back to your normal. Most surgeons will tell you, give it 6 months to a year before you really feel like that knee is your knee, essentially. You'll be done with rehab well before then, but a lot of times it does take quite a bit of time for your body to adjust to that hardware and to really kind of feel like you're back to the completely being normal with that. So I love this schematic here because we say this all the time here in the clinic. We all wish that rehab was this nice, steady, linear progress going all the way up, where things were constantly always getting better. In all reality, rehab and progress is exactly how it looks like in this squirrely picture here. There's going to be ups and downs, and you'll have moments where you feel like you're making tons of progress, and then you have moments where you feel like you're hitting a plateau. You'll have ups and downs and things like that. It is all normal after this type of surgery. The biggest thing that we look for is, in this process of all the ups and downs and twists and turns that may or may not happen, are you still making steady progress? Because that's what we're looking for, is that progress over the long term. And like I said, that's where that consistency comes into play as well, is putting in the work, hanging in there. It's a process. It's work, but putting in that effort, it will be worth it in the end, and you'll be glad that you had it done. Okay, we talked about a lot of information. I hope all of that was helpful for you to get kind of the physical therapy perspective on knee replacements, and kind of how to prepare going into the surgery, what to expect after the surgery. If you guys have any questions, please feel free to shoot them over into the chat box. If you have questions that you want us to answer, send them in the chat box, and we can get back to you either via email or things like that as well. Because I think the more informed you are going into the surgery, the better you're going to be coming out of the surgery. So please send any questions that you have over to us. If you're not familiar with us here at Resolve, we are located on the west side of Bend. We like to use Broken Top Bottle Shop as our kind of our marker here. We are in the same building as Broken Top Bottle Shop, just around the corner. So in our clinic, we have 4 physical therapists here. And we see all of our patients one-on-one. So we don't have any aides, we don't have assistants, nothing like that. So if you come to us for physical therapy, you're going to see the same therapist all the time, which is great. And then, all of our sessions, like I said, are one-on-one, and they're about an hour long, I would say. We have a nice quiet open space. And so if you are not really sure, you know, where you want to go for physical therapy, either before surgery or after surgery, we always do a free 30-minute consult. So if you want to come in and just ask us questions, you know, about things that maybe we didn't cover tonight, or other questions that you have that come up, or if you are kind of wondering, you know, is this the best clinic for me to be at after surgery? We are happy to set up, you know, that 30-minute consult. You can come in, you can meet us, you can see our space, that type of thing. You can ask any questions that you have. But again, the more that you're prepared going into this surgery, typically the better the outcome is afterwards. So shoot over those questions if you have them. Otherwise, on behalf of Casey and myself, we just want to say thank you for taking time out of your evening to spend with us. And we hope this was helpful for you. And yeah, if you have any questions, just let us know.
So you have 2 questions.